Doxepin is a medication that has been used for decades to treat a range of conditions, from depression to anxiety to insomnia. However, despite its widespread use, many people are still unfamiliar with how it works and what its potential side effects are. That's where this comprehensive guide comes in. Whether you're a healthcare professional looking to deepen your understanding of Doxepin or someone who has been prescribed the medication and wants to know more about its benefits and risks, this guide has got you covered. We'll delve into the science behind Doxepin, explore its various uses, and take a close look at the potential side effects that users might experience. By the end of this guide, you'll have a much clearer understanding of what Doxepin is, how it works, and whether it might be right for you or someone you care about. Medical uses of Doxepin. Doxepin is a tricyclic antidepressant that is used to treat a variety of mental health and sleep disorders. It works by increasing the levels of certain chemicals in the brain that are responsible for regulating mood, sleep, and anxiety. Some of the conditions that Doxepin is commonly used to treat include depression. Doxepin is often prescribed for the treatment of major depressive disorder. It can help to alleviate the symptoms of depression, such as feelings of sadness, hopelessness, and worthlessness. It is believed to work by increasing the levels of serotonin and norepinephrine in the brain, which are neurotransmitters that are associated with mood regulation. Anxiety. Doxepin is also used to treat anxiety disorders, such as generalized anxiety disorder and panic disorder. It can help to reduce the symptoms of anxiety, such as excessive worry, restlessness, and irritability. It is believed to work by affecting the levels of certain neurotransmitters in the brain that are associated with anxiety. Insomnia. Doxepin is sometimes prescribed for the treatment of insomnia, particularly in cases where other sleep aids have not been effective. It can help to improve the quality of sleep and reduce the time it takes to fall asleep. It is believed to work by affecting the levels of neurotransmitters that are involved in regulating sleep. How Doxepin works. As a tricyclic antidepressant, Doxepin works by increasing the levels of certain neurotransmitters in the brain, particularly serotonin and norepinephrine. These neurotransmitters are responsible for regulating mood, sleep, and anxiety. By increasing the levels of these neurotransmitters, Doxepin can help to alleviate the symptoms of depression, anxiety, and insomnia. Doxepin is also thought to affect other neurotransmitters in the brain, such as histamine and acetylcholine. This is why it can sometimes cause side effects such as drowsiness, dry mouth, and constipation. It is important to note that Doxepin can take several weeks to start working. It is not a medication that provides immediate relief of symptoms. It is therefore important to continue taking Doxepin as prescribed, even if you do not notice an immediate improvement in your symptoms. Dosage and administration of Doxepin. Doxepin is available in several different forms, including capsules, tablets, and a topical cream. The dosage and administration of Doxepin will depend on the condition being treated, as well as the individual needs of the patient. For the treatment of depression and anxiety, the typical starting dose of Doxepin is 25 mg to 50 mg per day, taken in divided doses. The dosage may be gradually increased over time, up to a maximum of 300 mg per day. For the treatment of insomnia, the typical starting dose of Doxepin is 3 mg to 6 mg taken at bedtime. The dosage may be gradually increased over time, up to a maximum of 6 mg to 10 mg per day. It is important to follow the dosage instructions provided by your healthcare provider. Do not exceed the recommended dosage without first consulting with your doctor. Potential side effects of Doxepin. Like all medications, Doxepin can cause side effects. Some of the most common side effects of Doxepin include 1. Drowsiness. 2. Dry mouth. 3. Constipation. 4. Blurred vision. 5. Dizziness. 6. Weight gain. These side effects are usually mild and go away on their own after a few days or weeks. However, if you experience any of the following more serious side effects, you should contact your healthcare provider immediately. 1. Difficulty breathing. 2. Irregular heartbeat. 3. Seizures. 4. Hallucinations. 5. Suicidal thoughts. It is important to note that Doxepin can interact with other medications and supplements, so it is important to inform your healthcare provider of any other medications you are taking before starting Doxepin. Precautions and warnings when using Doxepin. Doxepin should not be used by individuals who are allergic to it or who have certain medical conditions, such as glaucoma or urinary retention. It should also be used with caution in individuals who have a history of seizures, liver or kidney disease, or heart disease. Doxepin can also cause drowsiness and impair your ability to drive or operate heavy machinery. You should not engage in activities that require alertness until you know how Doxepin affects you. If you are pregnant or breastfeeding, you should talk to your healthcare provider before taking Doxepin. It is not known if Doxepin is safe for use during pregnancy or breastfeeding. Drug interactions with Doxepin. Doxepin can interact with a variety of other medications and supplements, including 1. Alcohol. 2. Antihistamines. 3. Benzodiazepines. 4. Barbiturates. 5. MAO inhibitors. 6. SSRIs. 7. SNRIs. It is important to inform your healthcare provider of any other medications or supplements you are taking before starting Doxepin. Overdose and missed dose of Doxepin. If you miss a dose of Doxepin, take it as soon as you remember. If it is almost time for your next dose, skip the missed dose and continue with your regular dosing schedule. Do not take a double dose to make up for a missed one. If you suspect that you have taken too much Doxepin, seek medical attention immediately. Symptoms of a Doxepin overdose can include confusion, agitation, and seizures. Alternative medications to Doxepin. If you are unable to take Doxepin or if it is not effective for your condition, there are several alternative medications that may be recommended by your healthcare provider. Some of these alternatives include 1. Selective serotonin reuptake inhibitors, SSRIs. 2. Serotonin norepinephrine reuptake inhibitors, SNRIs. 3. Benzodiazepines. 4. Antipsychotics. It is important to discuss the potential benefits and risks of these medications with your healthcare provider before starting any new medication. Frequently asked questions about Doxepin. How long does it take for Doxepin to start working? Doxepin can take several weeks to start working. It is not a medication that provides immediate relief of symptoms. It is therefore important to continue taking Doxepin as prescribed, even if you do not notice an immediate improvement in your symptoms. Can Doxepin be used to treat bipolar disorder? Doxepin is not typically used to treat bipolar disorder. Other medications, such as mood stabilizers, are usually recommended for the treatment of bipolar disorder. Can Doxepin be used to treat ADHD? Doxepin is not typically used to treat ADHD. Other medications, such as stimulants, are usually recommended for the treatment of ADHD. Is Doxepin addictive? Doxepin is not considered to be addictive. However, it is important to follow the dosage instructions provided by your healthcare provider and not to exceed the recommended dosage. Conclusion. Doxepin is a medication that is used to treat a variety of mental health and sleep disorders. It works by increasing the levels of certain neurotransmitters in the brain that are responsible for regulating mood, sleep, and anxiety. Like all medications, Doxepin can cause side effects, so it is important to inform your healthcare provider of any other medications or supplements you are taking before starting Doxepin. If you have any questions or concerns about Doxepin or its uses, be sure to talk to your healthcare provider. Thanks for watching.